Hi, this is Dr. Cliff Grunson coming to you with another Dr. Cliff's Riffs. Today we're going to be talking about the nervous system, and we're specifically going to be talking about nerve testing. There was a request for information regarding EMG testing and nerve testing, so we thought we would go through some of the basics of the what we're looking for, what are the indications for testing nerves, why do we care, and what does it mean for your overall health and diagnosis. So the purpose of today is really not to explain all the different possibilities of diagnoses for nerve injuries and nerve problems, but focused mainly on the test. We have talked about the bones in the past, we've talked about muscles, and today it will be electricity. So typically you think of nerve testing for carpal tunnel syndrome, the common problem of having numbness in your hands, or if you've got a pinched nerve in your back with sciatica, or perhaps you've got some burning foot pain, or perhaps some numbness in your feet that causes some weird tingling sensations, or even worse, having prickles or pins and needles feeling in your feet. So those sensations of numbness, pain, and possibly even weakness is oftentimes related to nerves. Now, what's the full complex of nerve processing that you feel and use to actually walk, talk, move, feel? It's very complicated. If you think about the entire nerve axis, it goes from the brain through the brain stem, the spinal cord, and then it actually exits the spine. It exits the spinal cord, and it's almost like crossing the boundary of a country. You've got a whole new culture, and you have now what's called the peripheral nerves. So the central nervous system, which is the brain and the spinal cord, follow different rules than the peripheral nerves. Nerve conduction testing that is classically done for carpal tunnel syndrome, peripheral neuropathies, is focused mainly on the peripheral nervous system. It is not used, the conventional nerve testing is not used for assessing the central nervous system. There is a different modality that you can use for testing the conduction through the brain and the spinal cord, but the usual nerve conductions, and EMG as we call it, is focused on the peripheral nerves. So what are peripheral nerves? Well, there's different types. There are types that are myelinated, which means that they have a covering around them, which helps speed up the conduction. That allows the electrical signal to actually bounce along those myelinated loops surrounding the nerve, which makes the nerve conduction go very quickly. There are other nerves that do not have the myelin on top of it, and that demyelinated part of the nerve goes much slower. Case in point, if you ever kick the bottom of a piece of furniture, you have an immediate pain in your foot. Those are the fast myelinated fibers. You step on a nail, boom, you feel it. The unmyelinated fibers are much slower. So you kick a chair leg or a sofa or something, and the immediate pain hits your brain. And then about 1 or 2 seconds later, there's this dull ache that you feel. And that's the signal along the unmyelinated nerves. Conventional nerve testing actually measures the myelinated nerves, the fastest nerves. The small fiber unmyelinated nerves are a little bit harder to test. There are ways to test them, but it's not the norm. Unfortunately, some pain syndromes follow the unmyelinated nerves, but many of the nerve testing that we can do, which assesses the myelinated nerves, can provide some information about the health of the nerve. Nerve conduction studies are unique because they actually test the physiology of your nerves, the physiology of your body. Most images that we have, or most diagnostic tests, such as MRIs, are just photographs. They don't necessarily say this is the problem, although sometimes they do tell you that based on the clinical scenario. You can see in this image you've got a disc herniation, but sometimes you can see just a messy looking radiology picture. You have no idea what might be causing the pain from something just from a photograph. Just like you take a picture of an old car with scratches and dents and hubcaps missing and bumpers hanging off, you really don't know where the sound is coming from just from the photograph. You have to really test using a physical exam and nerve conduction testing. So the unique part about nerve conduction testing and the EMG, which is studying the muscles with a very small pin, like an acupuncture pin, hooked up to a wire, allows us to actually measure the electricity of your body, of your muscles. And that's unique. There's not too many tests that actually study your true physiologic processes. So that's why it's a really interesting test. It also will test the synapses in between the nerve and the muscle, because there are some diseases that affect this, like myasthenia gravis, where the conduction across the cleft or the synapse between the nerve and the muscle is dysfunctional. EMG can test that. Now, EMGs are not used in isolation. They're an extension of the physical exam. A careful neurological exam should be performed so that you have a leading suspicion about what may be going on for the nerve testing, and it will help you cater your nerve testing and your EMG studies to the clinical scenario. So an EMG study is truly an extension of your physical examination. So what's involved with it? Well, for the preparation, you really don't need to do much. You can do whatever activities you like. The one thing that we do request is that you clean off the skin of any soaps or oils. Certainly don't put any lotions on your skin, because that can affect the conduction of the pickup electrodes. The procedure usually involves both the nerve conduction part, which is hooking little sensors to the skin, or attaching or taping sensors to the skin, and then stimulating the nerves and recording how fast and how well the nerve will travel down the nerve, pass by our sensor, and that we measure the speed and the size and the distribution of the shape of the nerve to determine how healthy that nerve is. The second part is looking at the firing of the muscles. It's very interesting when you undergo an EMG called electromyography, is we're recording the electricity of the muscles, and the muscles work in tandem with the nerves, because the nerves fire the muscles and the muscles will give feedback to the nerves. When there's nerve loss to the muscle, the nerves will regrow and actually reattach to orphan muscle fibers. So there's a very complementary set of information you can get from the nerve conduction studies along with the EMG findings. Now, is it safe? Yes, it's totally safe. Is it incredibly painful? No, it is not. It is not like an X-ray where you don't feel anything because the X-ray beams go right through you. There is a little bit of sensation when we stimulate the nerves. It feels like being snapped with a rubber band, or there's a little bit of a pulse. It's almost like touching a staticky doorknob in the winter and it sparks, but you're kind of a slow learner and you just keep touching the doorknob and it sparks a little bit. It's not an electric fence type of feeling. It's simply just this stimulation that we need to perform, we need to get, so that the nerve will fire and send its signal downstream. The needle examination, or the EMG portion, uses a very fine little plastic-coated acupuncture pin, and that is used to listen to the muscles as we talked about. That's not uncomfortable either. There are different muscles that we will test to look for the different patterns of your problem, but overall, the study, if done well, is not very uncomfortable. Is it safe? Completely safe. The only risk would be if you're on high-dose anticoagulants where you might bruise easily. Then you need to tell the electromyographer about that, because there are areas that you don't want to poke a needle and cause any undue harm. But by and by, there is really no long-term effects from the nerve testing and the EMG. The study itself lasts about 30 minutes, maybe 45 minutes to an hour, but it's really fairly quick study, unless it's a very complicated study for looking at things like Lou Gehrig's disease or ALS or myasthenia gravis or some other generalized systemic processes where the nerves might be attacked by the muscles. And those types of conditions are not that common, but they can occur. And defining where the problem lies, what might be causing it, takes a little bit of time. But the standard procedures for carpal tunnel syndrome or for, say, a pinched nerve with sciatica, those are typically fairly well-defined and easy studies to perform. You can wear loose clothing. You don't have to. You can take all your medications. You can eat. There's no limitations for doing the test other than advising your electromyographer that you are on blood thinners. Otherwise, everything is fine. And it is there's no need to do any specific aftercare. You can do what you like, go live life, and it's not a problem. So the bottom line is that the study itself, although it has fairly defined rules about how it's done, and the people that do it should be very well trained. At Spine West, we're all board certified, so we really focus on making the diagnosis as accurately as possible. And like I said, it is a very unique test for assessing nerve health, nerve function, along with muscle function, and can be used quite often for different scenarios depending on what your clinical condition is, especially anything involving nerves with numbness, weakness, or general unexplained symptoms that maybe would be peripheral nerve based. So I hope this helps explain some of the nuances of electrodiagnostic testing. If you have any questions, give us a call, and we'd be more than happy to share the information as best we can with you. Hope to see you again next time for the next webinar live, Cliff's Riffs. Thanks so much.